All right, how many pros you have?
One.
One pro. How many Army Navy tractors?
Augusta State Medical Prison has been around for more than 30 years, and over that time, they've had to make many improvements to the facility and their methodologies to keep up with the utmost level of care as both a prison and a hospital.
Yeah, what else we gotta put down? Essence?
Yeah, one or two X.
It's been very positive. So the amount of changes in a short amount of time has been significant. I do believe when December hits around, we'll make even that much more. The offender population, they're getting buy-in as well because they see the improvements.
Warden Ted Philbin started at Augusta State Medical Prison in December of 2017. He says as they've been making improvements and changes, the level of health care for their offenders has not faltered. He says the facility is unique in that materials, even down to the surgical tools, have to be counted for everyone's safety.
Come over here, I guess.
We made significant improvements as far as in that process, and we continue to improve on that. Where the trash is being taken out, we'll have a secured area outside of the building, and then if there's an issue with the tool coming up missing, we still know where the trash is. It is secured. But typical stuff in a hospital setting, it may be important, but in a prison setting, it's a whole different level.
The facility is also working on the lock and control system, adding additional holding cells, better lighting, and securing sidewalks for offenders. It will take the next year and a half to complete and will cost more than $4 million. They also have hired a health service administrator through their partnership with Augusta University.
Having a background, a hospital background, and it's really been she's been a great assistant as far as in trying to help and have that knowledge base. And difference of just a regular prison. I mean, typically a regular prison, if something goes on, you just can lock it down. Here, you got to have the movement for the dialysis clinic, some of your surgeries and things like that. So the operations still have to go on.
Augusta State Medical Prison has also been working on an abatement project for the facility, which they say only has a few weeks left until completion. They also are enforcing an annual terminal cleaning that will be monitored and inspected throughout the year by their new environmentalist.
We want to have better accountability, and our practices are such that they're measurable, and people know the average person walking in that is commensurate to the outside community.
That includes the change from tile floors to concrete floors in the medical units.
The Brighton that's doing the terminal cleaning is putting a diamond coat on the floor, so the floor will actually be sealed. From a sanitation perspective, we want concrete to be kind of porous, so we want to make sure it's sealed. So if you have any kind of spills, whatever kind of spills, that can be cleaned up. As far as the tile has its limitations, and so in the fact that it was easier just to have it removed and go straight concrete.
The facility has also taken extra precautions to ensure that all the offenders and staff feel safe while at the prison. The Assistant Commissioner of Health Services, Randy Saul, says they've given every member of the medical staff a panic button.
And this device emits a 130 decibel emitter sound that's heard, and we're trained our staff to respond immediately to when this is activated. What this does is each employee is issued one of these, they sign for it, they go through a short educational program, and they take responsibility for their own security by wearing this device. We audit to make sure that employees wear those when they're in the offender areas and when they're on duty. If you like, I'd like to just push it and let you hear it. We may get an immediate response, which will be the correct answer. Ready? So it is quite loud, and it can be deactivated by the user.
Augusta State Medical Prison has also implemented a new work order system that allows repairs to be received and prioritized to get them handled as quickly as possible. Other facilities have adopted the system as well, but even with all the changes already in place, Saul says there's always room for improvement.
We have a responsibility to care for these individuals under our custody. Augusta State Medical Prison is critical to meeting that mission. I think our offenders receive the highest quality of care that can be received anywhere, and they received care that would be worthy of anyone needing care in any of our facilities. So we're proud of that. We want to continue that legacy that's been before us and continue to make sure that in the days to come that the quality of health care in this facility or any of our facilities is not compromised in any way.
Saul says the plan is to use what they've learned to continue to improve, and that includes keeping up with all the technological and medical advancements in the future. Cassandra Ortiz for the Georgia Department of Corrections.